So I know we obviously also want to talk about high risk pregnancies. A lot of times premature births, are they tied into high risk pregnancy, or is that labeled completely separate?
Yeah, it is possible to deliver preterm with a low risk pregnancy. And oftentimes, when that happens, there is spontaneous preterm delivery. So nobody saw it coming and everything
Mm,
was totally fine. And there were no other issues that were known at the time that would even indicate that you would deliver preterm. That doesn't happen
mm,
very often. So anyone who's listening, going, "Oh my gosh, is this going to happen to me?" It probably won't. But I think that's usually the case off when there's is when it's not tied to a high risk pregnancy. Otherwise, there's often some kind of a sign, some kind of a signal. So for example, you're carrying multiples, twins or higher order multiples are going to likely be delivered preterm. Not always. There are moms who are able to carry twins to term, absolutely, but the risk is higher.
mm,
So, for example, in those situations, or you might have a very low risk pregnancy, everything's going wonderfully, and then you go to your appointment and you find out your cervix is shortening all of a sudden. So, suddenly that makes you high risk, or everything's going perfectly, beautifully, wonderfully, super low risk, and then you go in for your appointment and they find protein in your urine and your blood pressure is a little bit higher, or you're swelling a little bit. So,
mm.
no signs up until then. At that point, you become high risk. So I find the label to be less important than what's actually happening in your body and how much is that influencing what could happen for delivery and the timing of the delivery.
Okay. So at what point, and again, I'm sure this differs between each pregnancy, but at what point are moms told that their pregnancy is high risk? I know you did mention previously if their first pregnancy was high risk, typically their second will be. But for someone, if it's their first birth, how early could they be told it's high risk?
I feel like I'm just like, it depends all the time.
I know.
So there are some factors that we know. So in the United States, if you're over the age of 35, you're automatically categorized as high risk, which is why I don't love this title or the label so much, because it doesn't actually mean anything other than you're going to have some extra eyes on you, and there are slightly more risks to for complications for you or baby during pregnancy, during labor or delivery, but
Mhm,
it doesn't mean that it's for sure going to happen or that it's even likely to happen. You could just be, 36 and
mhm.
pregnant because that's when you got pregnant, and that could be it. And you could have a very uncomplicated, simple pregnancy and smooth, easy labor and delivery. So things like that. So age, whether you're carrying multiples, will put you in the high risk category. If you have a history of preterm delivery, second or third trimester loss, some perinatologists will calculate a high risk pregnancy based on even recurrent pregnancy loss in the first trimester. Not all of them will do that, but some of them will. So, some of those factors, if you have a history of any health complications like cancer, oftentimes autoimmune diseases, asthma, I'm starting to see more perinatologists qualify depression, anxiety, and maternal psychiatric illness as risk factors. So they consider those pregnancies high risk. If you have, kidney disease, heart disease, diabetes, things like that will put you in the high risk category. And so you'll know that before you're even pregnant, all of those kinds of things. After that, let's say none of that applies to you, and then you get pregnant, the complications can begin at any point in the pregnancy, which again, I realize can sound really scary. So I don't mean to say it's definitely going to happen to anybody that's listening, but that is actually also the reality, is that you can make it through the first trimester, which is often the trimester that women are like, okay, if I get past this, that's the scary time, which it can be for many, certainly. And also, there are complications that can pick up in the early to mid second trimester, end of the second trimester, or even the third trimester. And so it really depends, which is why really good quality prenatal care is so important, and
Mhm.
that you are monitoring yourself really well, that you have a really healthy lifestyle, and you are taking good care of yourself beyond just diet and prenatals and exercise. Like just whole health support can really help reduce those risks, as can neurobiological support to really help keep your body kind of in as optimal of a place as possible to reduce your risk of complications.
Awesome. And I mean, I love the balance too. I mean, I think like it's good that this doesn't happen to everyone, but it is good to be realistic too that, this can happen at different times in your pregnancy because, we want to share as much knowledge as we can here. So with high risk pregnancy, you're saying it's kind of like this label that, oh my gosh, it's high risk. But yeah, if you're 36 years old, it's automatically a high risk pregnancy. So in what ways are you monitored differently in a high risk pregnancy? And is it different based on the reason why you're high risk?
Yeah, it does
Mhm.
depend on the reason why you're high risk. So if you're high risk just because, say, age, or because you're carrying twins or triplets or something like that, typically most women who have high risk pregnancies will have at least one check-in with a perinatalogist. There are some cases, for example, if you're like the example we're using, you're 36, you're carrying one baby, there's no other health complications, it's very likely your OB is just going to continue working with you. You may not even see a perinatalogist, and your OB is going to keep eyes on things. And if anything starts to look even orange flags, like, they will send you over. So you may not actually even see a perinatalogist. Most of the time, many OBs will give at least one check-in and say, just go check in with them, do an assessment or do, a consultation. They'll probably tell you everything's fine and you won't see them ever again. So that's kind of on that side of the spectrum. And then depending on what's going on in the pregnancy, if there are multiple complications, like in my case, for example, or a lot of my clients, there are multiple either maternal or fetal or both complications happening. And so you could be seeing your maternal fetal medicine specialist weekly for ultrasounds, for testing, for blood work, for any number of things. And you may also have, which happens to my clients as well, sometimes we need to add other perinatal specialists, perinatal cardiologists or nephrologists or pulmonologists, because you do need even that additional specialized care. So it really, again, it
Mhm.
depends on what's going on in the pregnancy, but it can be really vary at any point in that spectrum.